chronic urticaria isn't a skin condition, it's an immune condition. And that is really where your answer is going to lie. When patients come to see me, they're usually like, hey doc, I know I'm allergic to something. I just haven't figured it out. We do need to understand why is their immune system all of a sudden out of the blue becoming so reactive. And a lot of times there isn't a single good answer.
This is the Transformational Life Consulting Podcast with Deepa, Grandon, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandon.
Before we begin, I'd like to extend a very special welcome to all of our first-time listeners. Thank you for joining us. Whether someone shared this episode with you or you discovered our podcast on your own, we are truly delighted that you're here. So at Time to Transform, our mission is to bring you evidence-based conversations that empower you to better understand your health and make informed decisions that can truly transform your life. We hope the insights we share today are not only educational, but genuinely transformational. All right, so have you ever felt like your body was attacking you? Maybe you've developed these super itchy welts that just appear out of nowhere, right? One day they're on your arms, the next day they're on your legs. They seem to come and go at will, and then they just come and then they go, and you're just like, what is happening to me? You've probably been given antihistamines, you've tried steroids, you've seen physicians, they run allergy testing on you, and they say, hey, everything looks normal. And maybe you've even heard someone say, oh, it's just stress. And then maybe even physicians have told you, I think it's something you've eaten. And then you find yourself eliminating foods, dairy, gluten, eggs, nuts. It doesn't matter what you're doing. These hives keep coming back. Does that sound familiar? Yeah. So I want you to know two things. One, your symptoms are real. And two, these itchy welts that you have, commonly known as chronic hives, they are far more complex than most people realize. And unfortunately, people who suffer with this condition will spend years searching for that external trigger. And they might think it's a food, it's a medication, it's a cream, it's a soap, it's a house, it's a mattress. And they can try to change all of that, and none of that is going to change the hives, right? Because that is not the cause. So today, I like to help change the way you think about chronic urticaria. We're going to explore what hives actually are, why allergy testing is so useless, and what scientists have discovered over the past decade about the immune system, and why factors such as stress, sleep, nutrition, and even your gut microbiome can influence this disease. More importantly, I want you to leave today's episode understanding that chronic urticaria isn't a skin condition, it's an immune condition. And that is really where your answer is going to lie, because while it happens in your immune system, it shows up on your skin, and so it can be very confusing. Okay? So today, as a triple board certified physician, internal medicine, allergy, immunology, lifestyle, I have seen hundreds of patients with chronic urticaria. And, many patients ask me this question, doctor, what is causing these hives? But for me, the question that I always like to lead with is not so much how do we stop this person's hives, but why is this individual's immune system becoming so reactive in the first place? So let's start with some basics. What exactly are hives? So the medical term for hives or those itchy welts is urticaria. And it appears as these raised, itchy welts that can vary dramatically in size. Yeah. I have had some patients where it only happens on their palms and their feet. I've had some, they look like mosquito bites. Some of them have these huge, giant welts. They all merge together. But a characteristic feature is that they move. One for a few hours, it's on the arm, then it's on the legs, and it's the belly, sometimes the neck, rarely on the face. So it's like this wandering pattern. And for most physicians, this is what we use to recognize chronic urticaria. And occasionally, these types of hives can occur at a deeper level. Like you can see that the eyelids are swollen, the lips are swollen, and we call this angioedema. And it can look super scary, right? So I've had many patients come into the office saying, "Oh my gosh, I'm going to die. I don't know what's going on. My lips are getting swollen. I think I'm going to stop breathing." Because they are so scared, it actually can cause their breathing to get worse and they feel like it's a huge, full blown allergic reaction. But a lot of times it's that anxiety component mixed in with what you're looking in the mirror and you're like, what's going on with my body? Because this has never happened to me before. So, in order to understand why hives happen, we first need to understand one of the most fascinating cells in the immune system, and that's called your mast cell. So, I often tell my patients to think of your mast cell as your body's fire alarm system, right? So, it's trying to alert your body to some sort of a danger, if you will. And these little mast cells, they are positioned throughout your body. And in fact, the largest concentration can be found on your skin. And that's the reason why when urticaria happens, you tend to see the rash on your skin. But it's not really involving your skin. And that's the reason why when it's like, say it's on your arm for a few hours and when it's gone and you look at your skin looks perfectly normal, right? Because it did not really involve your skin. And unless you scratched it really hard, you actually will find like, hey, my skin actually looks normal. But you also have mast cells in your airways. You have it in your digestive tract. And so for some individuals, when the swelling occurs in those areas, they can feel it really tight in their chest. They can have some gut pain. But normally, a lot of the urticaria is typically seen on the skin. Now, when I go back to that analogy of the smoke detector, what if your smoke detector all of a sudden started to malfunction, right? Instead of just detecting smoke, like anytime somebody had a shower or made toast or opened the oven, it would keep going off. It's pretty obvious that the smoke detector is malfunctioning because it's not supposed to go off just randomly for no specific rhyme or reason or for the minimal trigger. And that is essentially what's happening with chronic urticaria. Your mast cells are overly reactive. So anytime your mast cells get activated, they start what we call degranulation. So degranulation is simply where it starts emptying out its contents like chemical messengers into your surrounding tissue. So the best known of these chemicals is histamine. So histamine, along with other chemicals that your mast cell creates, it basically moves into your skin, your nerve becomes irritated, and that's why you see like all this redness, swelling, intense itching. And one of the things that we don't realize is how much this whole chemical process it attracts other immune cells. It just changes the way your blood vessels are behaving. It interacts with your nervous system. And these other chemicals, besides your histamine, it actually amplifies inflammation that's ongoing with this urticaria that we're seeing, right? And that's also the reason why antihistamines don't work for everybody. And a lot of times when patients come to see me, they're usually like, hey, doc, I know I'm allergic to something. I just haven't figured it out. And it seems logical, right? Because a lot of times when you see hives, you usually see it in an allergic reaction. You probably watched a movie or in some magazine, you saw somebody eating a food and they broke out in hives and it looked exactly like the hives you're having. And you're like, oh my gosh, what am I allergic to? And I haven't changed my diet. I haven't changed soaps and creams. What's going on with me? And the truth is, while you may not be having an allergic reaction, there's something going on with your immune system that's making your mast cells, what we say, twitchy, or they just get irritated easily and they keep secreting these chemicals very easily, causing you to break out in these hives. So, one of the questions I ask my patients is, how long have you had them? Because that helps us to kind of understand what's causing it. So if they've just had it for less than 6 weeks, we call it acute hives, and they're incredibly common. It can be triggered by a viral infection, medications. For instance, I just told you like NSAIDs, like ibuprofen, Advil. Certain individuals can be more prone to having these medications cause their urticaria to just get really aggravated, especially if you already have urticaria and then, you take, say, Advil for a headache and all of a sudden your rash is like significantly worse. It's because those types of medications can make your urticaria worse. Now, there are individuals who do truly have a food allergy, but typically when it's food related or medication related, it resolves pretty quickly because as soon as the food leaves your body or the medication half-life leaves your body, the trigger is gone, right? But individuals with chronic urticaria, they have it for more than 6 weeks. And that's why at that point, when people tell me, oh, my urticaria has been for over 6 weeks, we have to start asking different questions. And over the years, scientists have made some really remarkable discoveries about understanding chronic urticaria. And people who have chronic urticaria, most of them do not have an allergy. They have an immune regulation problem. And then, so at that point, we need to understand, why is this individual's immune system acting the way it is? And there are many different biological pathways that are involved in chronic urticaria. For instance, you can have two patients coming in with exactly the same identical rash, but the root cause or the pathway that's causing their rash can be very different, which is why they will respond to treatment very differently. For instance, there are some individuals, they could have underlying autoimmune disease, for instance, rheumatoid arthritis, lupus, Hashimoto's thyroiditis. And, these conditions, they can make your immune system attack you, right? So it's your immune system was made to protect you from external triggers or even things that can harm you. But when your body starts attacking your cells, we call this autoimmune condition. And for certain individuals with chronic urticaria, that is what is happening. So when we look at the immune system and see, okay, what's going on? Some people make a certain type of antibody, which is more your allergy antibody, which is your IgE, and it starts attacking proteins within your body. And so researchers call this autoallergic chronic spontaneous urticaria. And for the ones that have more of this autoimmune, where it's like, like the Hashimoto's and the rheumatoid arthritis type of autoimmune description, they have the antibody called IgG, which directly activates your mast cells, meaning you don't even have to have any trigger for no rhyme or reason. Your mast cells will just keep degranulating. And these individuals are actually the most difficult to treat. And while in traditional medicine, we don't have a very good way of distinguishing, does this person have an IgE-mediated pathway or an IgG-mediated pathway? And quite honestly, for a lot of people, they can actually have a combination of both. but trying to understand their family history. Now, do they already have other signs of autoimmune? Now, these are the individuals who have a higher likelihood of the IgG type of pathway. And why this matters is because then it'll help us to get a better understanding. Oh, now we know why this person's not responding to taking Zyrtec 4 times a day or whatever antihistamine, fexofenadine 4 times a day, right? And these individuals, they need to have gotten on to a biologic much faster, because sometimes it really takes the biologic like omalizumab to help them. So what we need to understand is our immune system, it never works in isolation. It's working in conjunction with your endocrine, with your gut, with your skin, and even your sleep wake cycle. It really influences how your immune system behaves. So you have to think of it like an orchestra and not like a single instrument. And that's the reason why you would have heard, people who have chronic urticaria being told, oh, it's your stress. And it can be really frustrating when you hear that, because it's almost like saying, oh, it's in your head. And that's actually not true, because the reason a lot of people can see this correlation is there's tons of research papers that have been published that shows a direct correlation with stress and chronic urticaria. In fact, I had a patient who had this awful divorce. Like, she was married 25 years, and then her husband left her. And she just came to me in this awful mental state, and she was covered with hives, which was just awful. And then, just convincing her that, hey, this is not an allergy. When you're undergoing so much stress, your brain and your immune system are also in constant communication. And having such deep psychological stress, your body makes stress hormones called your cortisol, or it's coming through your hypothalamic pituitary adrenal axis, which I've spoken about in the past. It's basically that fight or flight response. It activates your sympathetic nervous system. You just don't feel safe. And when you have these stress hormones and the neuropeptides, all of these are even more aggravating on the mast cells. And if you have a predisposition where your mast cells are already being very twitchy, imagine having all these stress hormones even aggravating your mast cells even more. And that's the reason why stress makes urticaria significantly worse. And we have large international studies that have shown this over and over again, that emotional stress is one of the most commonly reported factors that can worsen chronic urticaria. So you can imagine, and I'm sure if you have the disease, you don't have to because you're living it, that stress it doesn't necessarily mean it's your root cause. It just really turns up the volume and on an already very sensitive immune system. And that's the reason why I am a huge believer in stress management. And going back to my patient who was going through the awful divorce, I had to really go back to basics and teach her about, really protecting her sleep, taking time for herself, for prayer, for meditation, just taking steps to de-stress, whether it was taking nature walks, just taking some quiet time for herself, doing some breathing exercises, incorporating physical activity, because at that point she was just so focused on the divorce, and it was obviously not helping her hives. And doing these sorts of lifestyle measures, it wasn't just a supportive role, it was an essential role. It played such a significant role in helping mitigate her symptoms, so she was not taking tons of medication just to reduce her symptoms. And the thing that helped her the most was sleep. And, a lot of times we really underestimate the power of sleep. For many people, sleep is just, oh, I'm resting, but it's really your immune system is recovering during that time. Having a minimum of 7 to 8 hours of sleep is so important, because that's when your body repairs and resets so many aspects of your immune system. And when you become chronically sleep deprived, it increases that inflammatory signaling within your body. And in fact, researchers have demonstrated how even if you had like multiple nights of very limited disrupted sleep, it causes that inflammatory chemical secretions in your body known as cytokines. And these cytokines are like interleukin 6, TNF alpha, and they actually are going to aggravate your mast cells even more. So you can just imagine having, or maybe you're living it right now, you have urticaria, you're not sleeping well. And so it's just like putting fuel in the fire, right? Because of poor sleep, um, because of the itching, you're having poor sleep, and the poor sleep is causing your immune system to act even more aggravated, which in turn causes your mast cells to be more twitchy. And so, a simple strategy like maintaining consistent bedtime, limiting screen exposure before sleep, creating a cool, dark environment, reducing your caffeine intake. And if you have an underlying sleep disorder like obstructive sleep apnea, making sure you're using your CPAP machine, making sure you sleep properly. All of these actually will help control your urticaria quicker than if you were just to ignore it and just take medications for it. Okay. Another important thing to touch on is your gut immune connection, because one of the most exciting areas of research, and I'm very, very partial to this field, is the relationship between your gut microbiome and your immune system. I'm sure you've heard that approximately 70% of your body's immune cells are located in and around your GI tract. It doesn't mean that 70% of your immune system lives inside your gut, but it does highlight how closely connected these two systems are. And also, your intestines are home to trillions of bacteria, right? And many of these bacteria, they perform very important functions for our health. They not only help digest our food, but they produce very important metabolites that strengthen the intestinal bacteria, the barrier. And more importantly, they actually educate and regulate our immune system. And so, another story I can tell you about is a 17-year-old who came to see me with just awful. He didn't just have hives, he had joint pain because some of those histamine releases were in the deeper tissue. He could feel it in his joints, right? And talking to him and talking to his mom, he would just eat junk food very late at night, use all the food delivery services to deliver pizzas and burgers and Cokes and chocolates. And, this was his staple, and he was sleeping very poorly. So when I started to talk to him about his hives, how hard they were, he was already on 3 different antihistamines. He had come to see me at the time I was in a hospital setup. And because we were a referral center, I was going to start him on omalizumab. But I wanted to really introduce proper lifestyle because it was very clear to me just from the way he was describing that his poor lifestyle choices were contributing to how difficult it was to control his hives. And fast forward, we started him on omalizumab because he had to drive quite a distance to come and see me. I actually did not see him for almost a year. And a year later, when I saw him, I thought I was looking at a different person. He had lost weight, his skin had cleared up, and he was so excited that he was able to significantly reduce how much medications he needed to control his hives. And to me, that was he was like the poster child of how powerful lifestyle can be to push you in either direction, depending on the choices you make. And to me, it also pointed out how important these lifestyle habits have on your gut bacteria. Because there are studies now that find lower levels of certain types of very healthy bacteria called your short chain fatty acids that help to regulate inflammation, and it supports immune tolerance. And while we're still learning more about what this exactly means, and I'm definitely not recommending any expensive microbiome testing for everyone with urticaria, but it does hone in on the importance of a diet rich in vegetables, fruits, legumes, nuts, seeds, fiber rich whole foods, essentially a Mediterranean type diet. So when your gut is nourished with the proper types of foods, it actually helps regulate your immune system. It helps make it less reactive. So when we try to look ahead, we need to understand that chronic urticaria is not just about helping you with itchy skin, but it's helping you regulate your immune system. And a lot of times, individuals will need medication, they will need biologics, but a lot of times, there are many people who do respond well, especially if they're not sleeping, if they have a lot of stress, if they have vitamin D deficiency, if they have an underlying thyroid disorder. Trying to help these other systems also contributes to an immune balance, right? So the question you really need to be asking yourself is, if lifestyle matters, medication matters, how do we bring all of these together? Again, it has to do with talking to the individual, understanding their individual needs. What are they doing right now that can be tweaked, which has the potential to improve their current condition? So it's never one size fits all. And that's why taking time to know the patient, to know the individual suffering with this condition is so crucial. So the foundation of treatment, really, it's not to make every itch go away, because sometimes I tell my patients that we may not be able to 100% eliminate your itching, but we can definitely try to control it as much as possible. And if I can see there's obviously a lifestyle component that could potentially help, I definitely bring that into the picture and do the shared decision making with the patient. The importance of understanding the itch, because not all itchy rashes are urticaria. It can be eczema, contact dermatitis, vasculitis, sometimes even more threatening conditions like hereditary angioedema. And sometimes these conditions can look very similar. And that's why taking the time to understand, are there any triggers? Does pressure cause it? Does exercise cause this? Are there any medications you've been taking recently? All of this helps us to decide, what investigation should I be doing? What investigation should I not be doing, right? Because good medicine isn't just about ordering every test just because it's available to you. It's about ordering the right test for the right patient. Okay, I do need to touch a little bit about medication, because I think medication is very important. And as a lifestyle medicine physician, there's usually a misconception that, oh, if we're doing lifestyle, we just need to completely ditch medicine. No, that's not true. We always use it in conjunction with medicine, because modern medicine, and I don't need to tell this to most people, because we know that it has transformed the lives of countless of patients with chronic urticaria. Typically, we reach out for the second generation antihistamines because, they don't cause you to get so tired like your first generation antihistamine. And for many patients, they're surprised when I tell them, hey, you need to take your antihistamine scheduled, meaning once, twice a day, sometimes 3 times, 4 times a day, but you have to take it every day, not just when the hives appear, because it makes it much harder to control the hives if you're taking it as needed, because by then your mast cells have already dumped all those chemical agents that are causing you to have the hives in the first place. So it's much easier to control the hives when you try to keep your mast cells quiet and calm. And for patients who continue to have symptoms in spite of using these high-dose antihistamines, that's where omalizumab comes in. And unfortunately, there are going to be some patients that don't respond to omalizumab, and then we use other medications like cyclosporin, um, doxepin, dapsone. I mean, there's many things that we use, and it boils down to how much of an understanding do we have to why the immune system is acting that way. But it is an exciting time for allergy and immunology, because we do have more therapies that are being actively investigated. And so instead of just broadly suppressing the immune system, we're trying to understand how do we interrupt that very specific pathway that could be causing the problem. And, so this is where I feel like medicine is evolving. Medications can be incredibly effective. Sometimes it's absolutely essential. But the bottom line is every person has their own unique condition and situation. And we do need to understand why is their immune system all of a sudden out of the blue becoming so reactive. And a lot of times there isn't a single good answer, but taking the time to understand can help us to personalize the treatment and sometimes just stopping things. Because sometimes I have patients who just had to take NSAIDs recently. They had a surgical procedure, things like that. And so they are like all of a sudden, finding that, oh, I started this ibuprofen. Am I allergic to it? So, these are important questions to ask because that will give you a better idea of not just root cause, but understanding the big picture. Okay. And so I really hope that this has brought some clarity into urticaria because urticaria does not happen in isolation. Everything is connected. Sleep influences inflammation. Nutrition influences your microbiome, which in turn influences your immune regulation. Stress influences how your mast cells behave. Physical activity influences how inflammation happens in your body. So these systems are constantly communicating with one another. And by no means will I say lifestyle will change and cure your disease. It's definitely not what I'm trying to say. But it does mean that when we understand how these systems interact, we can often create a treatment plan that is going to be far more effective than just prescribing medications. Okay, so for me, it's not about let's do more tests, let's just try these supplements and let's do more medications. For me, it's about asking better questions, trying to take the time to understand so we can come with a good personalized treatment plan. So if you've been living with chronic urticaria, I want to leave you with something I hope you'll remember. There is genuine reason for hope because our understanding of this disease has advanced significantly over the past decade. Okay. We recognize that chronic spontaneous urticaria is just not an allergy. The more we understand mast cells, autoimmunity, immune signaling, gut immune connection, the more effective we can become with our treatment approach. And more importantly, I don't want you to think you're alone. I cannot tell you how many patients are so depressed. They feel like they're the only ones living with this condition. But the truth is, there are millions of people around the world that live with chronic urticaria, and most of them eventually do achieve excellent control of their symptoms. Sometimes they do require medication, sometimes they require lifestyle modification, but most often it's usually a thoughtful combination of both. So before we finish today, I'd like to share something exciting. After more than 2 decades of caring for patients within the traditional healthcare system, I've actually had the privilege of helping thousands of patients with allergic and immune conditions. And I would love to work in medicine in a very different way, where I have the convenience of listening to patients with more time to review records thoroughly, to understand not only the diagnosis, but the person who's living with that diagnosis. And that's why I created Transformational Life Consulting Medical. It's a virtual specialty practice. It's built around comprehensive evidence-based care, especially for patients who are struggling with really complex immune inflammatory conditions. And we are intentionally launching it in a very different way. Instead of opening our doors to hundreds of patients, we're beginning with just 10 founding patients, because this allows me to provide that in-depth evaluation, personalized care. It's just not possible in that traditional 15-minute office visit. So if you're struggling or someone you know struggling with chronic hives, you've seen multiple physicians, you still feel like no one has connected all the pieces. If you're looking for a physician who has the training and the experience of advanced allergy, immunology, internal medicine, lifestyle, and who utilizes the latest science surrounding the immune system, I'd love to invite you to learn more. You can visit www.tlcmedical.com to read about our approach and apply to become one of our founding patients. So if we are the right fit for you, it would truly be my privilege to partner with you on your journey towards better health.